Hello, I'm Senator Ben Cardin. Welcome to Facebook Live, an opportunity that I have on a regular basis to have a conversation with the people of Maryland, with experts on a particular subject. And today we're going to use this format to talk about COVID-19. We've done that before, and the vaccine distribution and where we are today and what is the prognosis for the future. There's no question that we're in a different position today than we were a few months ago. And I thought it was important that we have updated information for the people of Maryland. I'm very pleased. I have two people who are really expert in this area. Dr. Travis Gales, who is the health officer and chief public health service for Montgomery County. Montgomery County is one of the largest counties in the United States, one of the most diverse counties in the United States, and has been a leader in the COVID-19 vaccine distribution. And we have Dr. David Marcozzi, who's the incident commander of the University of Maryland Medical System. Both of our guests are professors and teach. I know that Dr. Gales is also a pediatrician. So we have, I think, experts here that can really help us get through a better understanding of where we are. I know that there are a lot of people who believe we still have a long way to go. There's a lot of people who think that we have solved the problem. There are people who have been fully vaccinated. There are other people who are still reluctant to get vaccinated. Let me start, if I might, with an observation from today. Today, Maryland was very privileged to have the Vice President of the United States, Kamala Harris, tour the M&T Stadium complex, which is one of the vaccine distribution centers. Governor Hogan was there. Mayor Scott was there. Senator Van Hollen and myself, along with Congressman Sarbanes and Mfume, as well as some of our county execs were also in attendance. So we had a pretty good showing. Bill Ferguson, the president of the Senate, was there. Adrian Jones, the Speaker of the House. So we had a good group of Marylanders as the Vice President toured the facility. We saw the frontline workers who I really want to give a shout out to. Our National Guard was providing a lot of the logistics for making sure that the center operates efficiently. We have a lot of healthcare workers and other volunteers and professionals who've made this possible. And starting this week, this is one of the centers in which you don't need an appointment in order to get a vaccination. Show up. The lines were not long. So we're at that point where we have a system in place with supply and distribution that all eligible, which are all adult people in Maryland, are eligible to get vaccinated, and we need them vaccinated. So first, I want to start with Dr. Marcozzi. I know you have something to do with what's happening in M&T Bank. Could you just M&T Stadium? Could you just explain to us, how this was set up, and maybe explain a little bit about what an incident commander is at the University of Maryland Medical System? It seems like you have to put out fires every day. Tell us a little bit about your job.
Senator Cardin, thanks very much. And it's really a privilege and honor to be speaking to you this evening with Dr. Gayles. And I want to just say hello to all of the Marylanders out there. The role of the incident commander, I'll start there, is something that Dr. Sunta with the University of Maryland Medical System put in place to think through in a very expedited way in a new organization that really drives decisive collaboration around any component of the response to COVID-19, whether or not it's hospitalizations or infection prevention practices, or now obviously for vaccination efforts. The work that's being done by folks at the M&T Stadium is truly unique, and it is internationally recognized. Dr. Jason Marks heads up that incident command team, but the key to that strategy, the key to that success has been that it is the state with Secretary Schrader and all of our state colleagues, along with our National Guard colleagues in the state of Maryland, with our UMS colleagues, all working together, no rank, no affiliation, but just recognizing the mission and driving the success. And the truth is that really tripartite group getting together, working together, has achieved what you saw today. And we were honored to have the Vice President there visiting.
So we have 6 mass vaccination sites in the state of Maryland in different parts of our state. We know that Montgomery County has been one of the most aggressive counties in trying to reach out to vaccinate its population. We also know that because of its location near the nation's capital and the fact that you are so close to Virginia and to other counties, that it's a challenge in that you have workforce and you have people who go from county to county. So Dr. Gayles, tell us a little bit about the strategy that was deployed in Montgomery County in order to try to have a fair system for distribution.
Well, good afternoon and good evening to everyone watching at home, and thank you for the opportunity to be here with you, Senator Cardin and Dr. Marcozzi and the rest of the team. We have also thank you for the work at the federal and state level for ensuring that we have the necessary resources to be able to mount the response that you discussed. At the very beginning of the vaccine distribution process, we recognized that we wanted to create a system where there was fair and equitable access across the county, because throughout the pandemic, we saw, based upon geography, based upon race and ethnicity, certain groups and different demographic factors had a higher risk and higher levels of COVID cases, as well as COVID-related fatalities. So we wanted to make sure that we implemented a strategy that took those factors into consideration when we were distributing and allocating the doses that were provided to us by the state. So we've used an equity framework that takes into consideration, it's identified, we call them the top tier zones and zip codes that have had the highest number of cases, as well as the highest levels of morbidity related to hospitalizations, as well as COVID mortality, to factor in terms of how those doses have been allocated. We've worked tirelessly with our community partners to provide doses to them, as they are trusted resources and have long established footprints within our different communities, to set up pop-up opportunities, everything from pop-up opportunities to homebound vaccinations, again, to increase penetration throughout our communities. We've also partnered with our minority health initiatives and programs and our health systems to increase outreach and education to address any concerns related to hesitancy. And we continue to leverage all of those resources as we move forward, now that we do have a mass vac site in the county, to ensure that all of our residents have an equal opportunity to get vaccinated so that we can move forward and reopen our society.
And we should point out there are not only 6 mass vaccination sites, but there are numerous places that individuals can get vaccinated today, including mobile vans that have been made available. And we'll talk a little bit about that. I'm going to talk a little bit about what happened in the early months of the vaccination program, only because I want to make sure that as we plan for the future, we don't repeat the mistakes that were made early in the process. And I'll just give you my observation. Early in the process, it was at best inconsistent information being given through the federal government to the local governments as to the supply and the reliability of the supply, as to the priority setting and how the priority setting should be done, how appointments should be made. In fact, no direction as to how appointments should be made. There is no national direction. That's changed pretty dramatically under the Biden administration, and the supply issues are now much better understood. The support for distribution systems are much better understood, and a real commitment towards equity in reaching the underserved communities. And there's a lot of challenges, and I want to talk about the underserved communities. So, at least initially, it was very confusing. I had many people say, look, I live in this county, but I think I'm better off going to that county, or I live in this state, I'm better off going to a different state. Different states had different schedules for their priorities, and people were panicked in order to get the vaccination. So I think we all know stories of people getting in their cars, driving 400 or 500 miles in order to get the shot in the arm. And I don't blame them. They wanted to be protected, and they found it easier to go someplace else to get it. That should not be the case. It should have been a uniform system. We should have done that, and we didn't. And I've spoken out against that, and I want to make sure as we prepare for the future, and there will be, as we know, we have the variants, and we'll talk about the variants, and there's going to be new viruses that are going to come about. We hope they'll be nowhere near as deadly or challenging as COVID-19, but we need to be prepared. So let's talk about the current status. President Biden mentioned last night in the State of the Union address that he's gotten over 200 million shots in the arm since he took office. His goal was 100 million. He's more than doubled that goal. We know that throughout the country now, any eligible person, that's anybody over the age of 16, is eligible for shots. How well are we doing in vaccinating Marylanders in numbers and in equity distribution and reaching out? Dr. Gayles, why don't we start with you this time? We'll maybe rotate back and forth. We'll start with Dr. Gayles, and I'll give you a shot, and then I'd love to get the thoughts of Dr. Marcozzi on this also.
Sure. We've made tremendous progress on a local, regional, and state level in terms of the percentage of folks who've been vaccinated. I think, at least in Montgomery County, we now have over 53% of our residents having received the first shot and over 35% of our residents being fully vaccinated. And I think the state numbers are comparable, a little bit lower in terms of overall averages, but we've seen that number increase significantly over the last 2 months. We do still see some gaps when we compare Black residents and Latino residents compared to white residents across the board. However, we've closed those gaps significantly in a number of jurisdictions. I know in Montgomery County, originally when vaccine distribution started, the gap between white residents and Black residents was over 20%. That gap in difference in percentages, I think, just shy of 3% right now. So we have made tremendous progress, but we've got tremendous amount of work to do, because in a lot of areas in the state right now, as you've seen with the shift from scheduled appointments to walk-up, it's due to the demand not meeting the supply level. And so we've got extra work to do in terms of going through and encouraging our different communities to get vaccinated now that we do have, in many places, ample supply available, and shifting those resources to those places where we still have a lot of demand and not enough supply to meet the need to address those concerns. So we've made progress. We do have a long way to go. And to your point, Senator Cardin, about the infrastructure, we're really hopeful that this has been hopefully a great learning opportunity for those to understand the different intricacies of a public health response, to ensure that all of these situations informed by social determinants are addressed and the necessary resources are put into place so that the infrastructure is already in place, so that, God forbid, we have another pandemic, we don't have to recreate the wheel, and we'll have meaningful investment into those resources to be able to mount an adequate response.
The University of Maryland medical system has penetrated most of Maryland in some form or another. You have facilities located. How well are we doing, Dr. Marcozzi?
Yeah, thanks, Dr. Cardin. And I think Dr. Gayles did a great job of kind of providing an overview, both from a county level to state level. To date, I think, we're in the Maryland state is in phase 3 of its vaccination campaign. I think with over about 4.5 million vaccines administered to date, and actually close to 2 million individuals in the state fully vaccinated. I agree, and I want to just bring back the thought you had with regard to lessons learned. It's incumbent upon all of us at the local level, at the federal level, to learn our lessons. What did we do wrong? What did we do right? In a go-forward strategy that we appreciate the aspects of responding to an event like this successfully, whether or not it was the healthcare system or the public health system, and ensuring those two systems are ready to respond. As Dr. Gayles mentioned, and our public health infrastructure has the necessary components to make sure that vaccine administration in all communities, for all walks of life, are appropriately administered, is key and fundamental to any pandemic response. How is UMS doing? We're very proud of the efforts that we've been involved in to date. From the M&T Stadium to all of our hospitals embarking on vaccination campaigns early on. Not only do we think through how we're going to engage our own patients and our own workforce, but then we then pivoted to our communities. And how could we effectively support our communities from vaccinations? And right now we continue to vaccinate both our inpatient sector, our outpatient patients and individuals, and our communities, to assure that we have taken a really comprehensive look And lastly, Senator Cardin, you mentioned one thing that I want to press on for one moment, was that the ability to go into communities, to take mobile assets and move into communities and meet people where they are, fundamental. And it is one of the things that the Baltimore Convention Center, that is a joint Johns Hopkins and University of Maryland medical system endeavor, that is going out into Baltimore City to embark on exactly what you spoke to: mobile assets to embrace our community, so that if they can't get a vaccine, we bring it to them.
So I want to talk about our efforts, particularly in the underserved minority communities, because Governor Hogan has told us that Maryland now ranks 14th among the 50 states as it relates to the getting the shots in the arm. That's good. 14 is good. I'd rather be number one, but 14 is good. And we have obviously a state that has challenges that some other states do not have. And when you look at the percentages, Dr. Gayles, you mentioned this earlier, the percentages of those who have gotten their first shot and who are fully vaccinated is much higher in the white community than it is in communities of color. And that means we have not been as successful in getting shots in the arm. We can discuss why that's the case, but that's the facts. So we need to do better. We know that COVID-19 has been particularly damaging in minority communities. They've had higher rates of the virus, higher death rates, higher hospitalization rates. We have more frontline workers who are people of color that have been at higher risk. We've had some industries which have a large number of minority employees that have not had the same degree of protection as other industries might have, or they cannot work remote. They all have to work in person. So we've had this circumstance. You put on top of that the systemic challenges that we've had in our underserved communities and access to healthcare. You put all that together, it means that we really need to make a special effort. We have a vaccine equity task force. We had these pop-up clinics. We had the public relations campaigns that are going on. Tell us what more we need to do so that Maryland can not only be a leader in the number of people who are vaccinated, but that it fairly represents the population of our state. Start with Dr. Marcozzi, so we'll root back and forth.
Thank you, Senator Cardin. I think that you're right. We can always improve. In any disasters that I've been involved in, from 9/11 up until certainly this disaster, there are always lessons to be learned and ways we can improve, and we should improve. But to your point on how we are embracing and making sure we go out to allow our communities that are higher risk, our Black and Brown communities, to have the ability to obtain this vaccine is critical. This virus really amplified and magnified the health disparities, whether or not it was around the viral transmission, whether or not it was healthcare access, or whether or not it was ability to obtain the vaccine. And I think we should learn we want to learn the lessons of understanding how healthcare disparities, as a result of this magnification, we need to target and take intentional steps to recognize that, and then to start to take appropriate mechanisms to mitigate some of that. And I'll tell you how, from a vaccine strategy, we are doing that presently. So we're engaging and embarking on ideas like those mobile teams that we're going out into communities. We're engaging churches and meeting people where they are. We're also allowing the ability, and you mentioned it, no arm left behind, the state's effort for, if you want a vaccine, just walk up, no appointment necessarily, and you can get a vaccine. From barbershops to churches, from primary care offices to pharmacies. This has got to be an all of Maryland response as a result of some of the data you mentioned.
Dr. Gayles.
Thank you. That was a great answer. I don't have much to add to that, but what I would say is this creates the opportunity to have a conversation to address, Senator Cardin, the things that you talked about, the systemic issues and barriers that continue to influence health outcomes. As was mentioned, the health disparities in COVID have been profound. They have been significant, in large part due to race and ethnicity. In some parts of Maryland, race and ethnicity less, but when you talk about income disparities, where there's significant income opportunities, where you have folks, again, the type of work that people are allowed to do, not everybody could telework, and not everyone has paid leave to be able to stay home if they're sick or family members are sick, thereby increasing their potential risk of exposure. Again, and not everyone has equal access to health insurance and health care, even if they do have insurance. So this is an important opportunity to have those types of conversations to address what are the continued systemic root causes that continue to perpetuate those disparities that have been on display here in COVID-19. So I think a fuller examination of how we build systems and structures to address and understand how policies across the board, whether we're talking about housing, education, economic development, transportation, how those different policies impact health outcomes so that, again, God forbid we have another pandemic or a large-scale health issue, we don't see those same disparities that we've been talking about for decades continue to be perpetuated.
So, and I'm not a health expert, but as I understand it, there is virtually no reason why a person should not get the vaccination. If you have a specific allergy, maybe that's your doctor will let you know that to the platform vaccination that's being used. That's very, 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 very rare. But there is fear out there for people to get the vaccination. There's misinformation that's out there. And we find that at a higher rate within the minority communities. There's mistrust as to the past experiences in regards to vaccinations. So I think what you're doing is the right thing, and that is the people in the community trust their local leaders. And if the message comes out of Washington or it comes out of our national or local leaders, it's not quite as effective if it comes out of your pastor or comes out of your local healthcare provider. So I applaud the efforts you're making because I think that's exactly what you're doing. You're providing the local information, and it makes a difference. And you're using people in the community to spread this message that have credibility in the community. So since I have two doctors here, is there, if a person has concern about whether it's the right thing to do, what should that person do, Dr. Gayles?
I think the most important first step is to make sure you have access to high quality information that is true, it's fact-based, it's evidence-based, to be able to answer questions. I think, unfortunately, in many instances, our answer to vaccine hesitancy from kind of the 30,000-foot view has been to say, well, I don't understand why people have concerns, and I don't understand why they have mistrust, and I don't understand why they're anxious, as opposed to asking folks, what are your concerns? Tell me a little bit more about it. Some of those concerns could be informed by history and public health responses that we've seen 40 and 50 years ago. For many, it's shaped by their lived experience in terms of interfacing with the public health enterprise and the healthcare enterprise within their lifetimes. So I think we've got to do a better job of asking those questions to understand what it is that's driving folks' hesitancy, and to be able to develop platforms that are respectful of different languages, are culturally competent, and also delivered, as you pointed out, delivered by people who are trusted folks and voices within the community and sharing that information. And again, I think it goes back to the previous point of when asking folks to trust any system and to trust a vaccine and those kinds of things, taking the time to acknowledge those different factors that drive those disparities or that continue to perpetuate those differences in health outcomes, I think goes a long way in terms of instilling and engendering trust within different communities. And it's interesting, we've actually found here in Montgomery County that the percentage of folks getting the vaccine, there hasn't been huge gaps in terms of hesitancy by race and ethnicity that we thought, or that many people thought early on. It has actually started to break from a political ideological standpoint. And so, because of that, you've seen, for example, I know several Republican congressmen who are physicians, doing public service announcements to encourage folks to get the vaccine. So I say all that to say that, continuation of many of the things that you talked about, and I would encourage folks to get some good quality information. The last thing I'll say is I know a lot of my family members, me being in public health, I've been promoting the vaccine for months before it even came to fruition. But a lot of them said, well, we're going to wait until you get it first and see how you do, and then we'll decide to, we'll get it. And fortunately, my experience was okay. And we've been very public and transparent about sharing those experiences, again, so that we've got representation to all members of the community, that they've been able to see folks who look like them from different walks of life and different backgrounds get the vaccine and have positive experiences, and thereby encourage them to get it.
And we were so proud when leaders in the local community not only got their vaccinations, but they did it in a very public way so people could see it, and they responded in real time that this is the right thing to do. Dr. Marcozzi, could you add to this? What else should we be doing to reduce this fear that's out there?
Well, thanks, Senator Cardin. Dr. Gales was spot on. I mean, we all make our own decisions based on our own understanding, our own perception of risk, and our own appreciation for the environment of which we're in. And candidly, I think that we're going to have to have double the impact, to double our ability to vaccinate more individuals. We're going to need to triple our efforts. And how do we do that? It is really thinking through, meeting people where they are with regard to some of these. And you hate to use the word hesitancy, because I'm not sure if it's hesitancy. I think it's just people make decisions on their own comfort level and at their own time scale, and understanding all of the pieces of information out there. One thing you mentioned, you asked Dr. Gales, was around there's a lot of misinformation out there. And unfortunately, that's being promulgated. And I think that is something we need to target, we need to address and understand it, because folks hear some of those concerns. And whether or not you respond to a Facebook post, you look through an email, or you see it on the news, each of us responds to different influences differently. I'll tell you one perfect example, and I'll just be brief. I was walking through the ER, I'm an emergency physician, and one of my colleagues, Will, stopped me and said, "Hey, Doc, did you get your vaccine yet?" And I said, "Yeah." I said, "Will, did you get yours?" He said, "No." I said, "Tell me why." Now, this is a healthcare provider in a high-risk environment. And Will's comment was, "Well, to Dr. Gale's point, just kind of want to see what happens to everyone else before I get my vaccine." So I sat down and talked to him, walked him through some of the data. And at the end of that conversation, that one-on-one interaction was helpful. And Will actually went and got his vaccine the next day. But those kind of interactions, each of us respond differently. And having a multi-language approach and a multicultural approach to understand where people are and meet them where they are in this vaccine is an important strategy going forward.
So I want to give you one of the challenges that we have. We have a question in the chat, one of our viewers, Susan in Carroll County, who has a close family. They all want to get their vaccination together as a family. However, they have a teenager, 16 years of age, and they can't find a location where a 16-year-old can get a vaccine. And they want to know when that's going to open up. Now, I'm going to give you my advice ahead of time before I get the experts' advice. I don't know if that's a good idea or not. I just encourage people when they were eligible to get their vaccinations to get their vaccinations. Every person in your family who's vaccinated makes your family safer. And if everyone can't get the vaccination at the same time, get vaccinated, because you're helping your children, you're helping your spouse, you're reducing the risk of the spread of the virus. But let's talk a little bit about 16-year-olds and when we expect to have vaccines readily available. And then, of course, for those under 16 years of age that are not eligible, and we do not have a foreseeable future when vaccines will be available. Dr. Marcozzi?
Senator Cardin, you answered it exactly how I would have answered it. I don't know. We'll give you the MD after your name. I think that you're exactly right. I recognize that one of our vaccines today, just for context, is approved for those 16 and above, and that's the Pfizer vaccine. And as we continue to think through how we're going to embrace younger populations through Pfizer, Moderna, and other vaccines as they roll out. It will be a stepwise progression. So, 15 and lower to a certain age group, 15 to 12, and then obviously lower 11 to potentially 6, and then potentially even lower than that. But it will be phased through time to ensure that they are safe for those for our children. And candidly, I'll be upfront with you, Senator Cardin. I look forward to that occurring. I have 3 children, and when the vaccine is approved for them, I will be certainly in line with them and making sure they get the vaccine. But before then, to your point, I and my wife were vaccinated so that we can, as much as we can, protect them from getting this from COVID-19. So I think that your answer was spot on.
Dr. Gales, I'm going to expand this a little bit. There are 2 readily available vaccines in our community, Moderna and Pfizer. We also have the J&J vaccine that is now available, as I understand it. And we have the AstraZeneca that is being talked about rather freely here in the United States, and there are others in development. So walk through a person who says, look, I want to get only vaccination A or B. I don't want this one. Which one am I getting? Et cetera. We know the 16-year-old issue, that's a separate issue. We also know the storage issues are different and the number of shots are different. But what advice do you give someone who comes up and says, look, I understand I could get vaccinated, but I would have to get this vaccination, and I really don't want that. I want the other.
Well, I think the first thing to say is that all of the vaccines that have been approved by the FDA and CDC for use are extremely effective in terms of preventing COVID-related hospitalizations and certainly reducing and preventing any type of COVID-related fatality should anyone contract it. So the advice that we're telling folks is to take advantage of the first vaccine opportunity that you have, because getting vaccinated protects not only yourself, but it also protects those within your network. Now, I think the second thing to think about is it creates an opportunity to have a conversation with someone to ask what is their particular issue with a vaccine and to provide information to address those concerns. So as you referenced, we do have, for example, the Johnson & Johnson vaccine there was a pause in the use of it for several weeks due to some concerns about blood clot formation in an extremely small subset of folks who took the vaccine. And so part of that conversation is saying, all right, let's look at the numbers. We saw 15 reported cases or suspicious cases that were reported to the FDA for review out of 8 million individuals who received the vaccine. That's an extremely small number of folks compared to when you look at, for example, the potential for complications should an individual actually contract COVID-19, and actually much smaller compared to the risk of developing blood clots with a number of other medications that have been FDA approved and used for many years. So taking advantage of the opportunity to ask specifically what their concerns are and providing good information. I do think there are some situations where we have identified communities where a 1-dose versus a 2-dose shot may be more effective due to logistics and the ability to follow up with them. I think we have to continue to think strategically and smartly about how we leverage the different vaccines to take into consideration those types of facts. But at the end of the day, the most important thing to emphasize to folks at home is all of the vaccines that have been approved and that are being used have been nearly 100% effective in terms of preventing COVID-related hospitalizations, and certainly effective at the same levels in terms of preventing COVID-related fatalities.
So I want to answer Susan's direct question. If you have a 16-year-old, you're looking for the site that would provide that vaccination that's available. Is there a way that she can find out where that vaccination is being given for 16-year-olds?
Well, currently there's only one. The Pfizer vaccine is the only one that has been approved for that age group. And so I believe in looking at the state sites, they do have information to show what type of dose is being administered at those respective clinics. And Pfizer also, as a subset of that answer, has requested an FDA review to actually use their vaccine down to age 12. And we anticipate that that hearing is likely to happen in the near future for further consideration. So I would say when registering for sites, whether you're looking at the state sites, and I'm not sure, I know your health officer in Carroll County, Ed Singer's a great guy. I don't know specifically what types of vaccines you all are receiving there to your local health department, as we find those out on a weekly basis. So if you're, for your 16-year-old right now, be looking for a site that has a Pfizer dose, as that is the only one that is currently approved for them to get it.
And we do have Pfizer vaccines in Maryland, so there should be locations in Maryland where they're giving out the Pfizer vaccination. But for the general public, all of the vaccines that are available are of comparable value from preventing the disease and the worst outcomes from the disease. So when you shouldn't be as concerned about what vaccination is being given, just make sure you get it done as quickly as you can. We need the shots in the arm. All right, I want to change subjects a little bit, but first, let me first acknowledge my two guests that are here, Dr. Travis Gale, who is the Health Officer and Chief Public Health Services for Montgomery County, Dr. David Marcozzi, who is the Incident Commander at the University of Maryland Medical System. Our conversation is dealing with COVID-19 and the vaccine distributions. So, yesterday, I was privileged to be on the floor of the United States House of Representatives representing the people of Maryland in the United States Senate to listen to the State of the Union address. As a requirement for me to be there, I had to be I was already vaccinated, fully protected, but they still required I wear a mask. They still required that I be distant in those that were in attendance. The vice president was here in Baltimore earlier today, as I mentioned. We all wore masks, we distanced, we even had testing done. We took all these precautions. My question, why is it still important to wear masks, to do social distancing, to practice good hygiene and washing our hands, to not be in public if we're not feeling well or we have temperature? Why is it still important if you're fully vaccinated or you feel, look, I'm not going to get sick. Why can't I just go out and not have to have the inconvenience of wearing a mask? I think we're up to, I think it's either one. Who wants to go first? Dr. Marcozzi, I see you volunteering, so I'll go to you.
I was giving the nod to Dr. Gales.
Okay, Dr. Gales. Go ahead, Dr. Gales.
All right.
I'd be happy to start and throw out a couple ideas and thoughts. The first one is good hygiene is important in general, because I have a question for folks at home. Have you heard us talking about the flu? You haven't. Well, one, COVID-19 has dominated the airwaves, but we've seen flu cases drop significantly, in large part due to wearing face coverings and good hygiene and limiting exposure to others. But the reality is we still encourage folks to wear those face coverings and practice physical distancing, because even though we're celebrating the fact that in Maryland over 50% of our residents have received a first dose, that means we still have a whole lot of people who have not been vaccinated or received a first dose. We're talking over 40% of folks. And what's troubling about it is we also continue to see the novel strain of COVID-19, but we're also starting to see a significant rise in the number of variant cases and variant strains of COVID-19. And these strains are more contagious and spread more quickly and easier than the novel strain. In fact, in the state of Maryland right now, just based upon the limited subset of samples that have been sequenced, we know that the B117 variant strain, or otherwise known as the UK strain, has become the predominant strain across the state. And in actuality, in conversations this morning with the state, we found out that the Brazilian strain, or the P1 variant strain of COVID-19, is actually on the rise in the state. And what we we encourage folks to continue to do these practices, because when we look overseas and we look to other areas, we see how quickly these variant strains have spread through respective communities and the havoc that those strains have brought to their health systems, as well as their infrastructure. And so as we celebrate all the progress and we celebrate moving forward, we don't want to have to step back and pull back provisions that we've opened up due to another wave of cases and another wave of our hospitals being impacted, because we're getting more cases of the variants while we're still trying to catch up with the percentage of folks vaccinated and protected.
Dr. Marcozzi, what is a variant?
Yeah, thanks, Dr. Senator Carr. Dr. Gales, you gave a great answer with regard to why we still need to. And I want to just highlight one thing before speaking of the variant. The word you used was socially distant. The word Dr. Gales used was physically distant. And I want to just make sure I press on this one piece because I think we got ahead of our skis a little bit from a communication standpoint. The importance of staying physically distant, no one can dispute because of the virus being transmitted. But the ability to stay socially connected while we maintain our physical distance is critical in this. We're not only suffering physically from this virus, we're suffering mentally from this virus. So it's important that we all stay connected. That's the first thing. And the second thing around why wearing masks. In a disaster, which is what we're in, I always focus on three things: be simple, cheap, and effective. And masks are all three of those things: simple, cheap, and effective. And they limit the spread of this virus. With regard to variants, which is why there's still sensitivity, and when you're on the floor of the house, you needed to continue to maintain physical distance, was because variants basically change their coat so that we don't recognize them as well. Our bodies don't recognize them as well, and they hide, but have the potential to hide from us. Fortunately, the vaccines that we presently have still protect us from these variants. And that's a key piece. So even though we have these variants, the vaccines presently are protective against them. Another reason why to get vaccinated. But it's important to note, we are also getting more data in. And as we uncover the P1 variant or the variant now in India, they have the ability potentially to evade our immunity, which makes us more susceptible. And that's why not only do these vaccines protect us, but the more of us who get vaccinated, the less of a chance for variants to occur.
So I've heard the term herd immunity. What does that mean? And are we at herd immunity when we've gotten so many people fully vaccinated? Dr. Gayles?
Sure. Well, herd immunity is basically the notion that if you reach a certain percentage of the population getting vaccinated and immune to a particular infection, that you basically prevent opportunities for the particular infection to spread throughout the population. So the assumption is that in the absence of getting everybody vaccinated, if you get enough people vaccinated, you effectively shut down the spread of the infection because it doesn't have anywhere to go. You limit the opportunity of it to spread to different people because you have so many people covered and protected. Now, there's lots of numbers that are thrown out in terms of, say, well, 60%, 70%, 80%. The key is we want it as high as possible in terms of the number of folks vaccinated. So there's no magical number. Ideally, we'd love to see somewhere upwards of high 70s, over 80% of folks covered in the population to feel some semblance of a herd immunity. But it's tricky to really get that established because, as Dr. Marcozzi pointed out, there are the variant strains that are popping up as well. So we're going to continue to press to get the percentage of folks vaccinated as close to 100% as possible, recognizing though that, again, if we do have a critical enough mass of that will hopefully be able to drive the infection out with basically denying an opportunities to spread from person to person.
So, Dr. Marcozzi, can we get to herd immunity if we don't have a vaccine available for the younger children? Wouldn't that give us a number in our population that can still get the virus that would allow it to be able to live in our community?
It's important that we continue to do research to ensure safety is paramount for vaccinating children. You bring up the fact that is the concern that there, although fortunately, and I say this, and I'm knocking on wood as I say this, children are not. They are becoming infected, and they are potentially, some of them, becoming ill and even dying from this virus. So let's be honest, it is still a risk, but it is a significantly lower risk from other vulnerable individuals. But the question then remains, is the virus moving through our pediatric population, our children, so that there's still the need to vaccinate our children to protect us all from this virus? No question about it. That's why the studies are being conducted. Vaccinating children during this response is critical to getting to herd immunity.
And we have a question from from our audience with someone who has the antibodies. And if you have the antibodies, do you need the vaccination? And is the vaccination similar to what antibodies are? So you're really doing the same thing. Can you just help us understand that, Dr. Gales?
Sure. So I'll try not to be too overly technical with this, but it gets to two questions. One, the actual question related to, if you've had COVID-19, should you get vaccinated? And the answer is yes, you should get vaccinated. And then what's the technology behind the different vaccines? So the way the COVID-19, or at least, for example, Pfizer and Moderna, those vaccines work are through a mechanism called messenger RNA technology. And what happens is the vaccines introduce, if you can think of it, components of the virus to the body to tell it how to respond to the proteins that are a part of the virus. So that you get the vaccine, you put it in your arm, it sends in the information how to code for these different proteins, and it allows your body to be able to mount a response so that in the future, if it sees that protein or if it sees that virus in the body, it's able to mount a response and block it from causing further infection. Now, one of the reasons why we encourage folks to get the vaccine who had COVID-19 is that it is still not fully clear the amount of that window of protection that you would get from those antibodies would have in terms of being able to mount an effective response to prevent you from getting the infection again. It's been discussed somewhere between, if you've had COVID-19, that your antibodies are present for up to 3 months. And then, as you also know, there's been ongoing conversation about at what time will we need to get boosters after having received the first set of vaccine so that our bodies will be primed again to be able to mount the appropriate and adequate response should we encounter COVID-19 in the future or any viruses within that family.
Dr. Marcozzi, are we going to need boosters?
I think we are, Senator Cardin. I think Dr. Gales mentioned that the question fundamentally is, how strong is our response when we are either infected by the virus or have a vaccine, and then how long are we protected from that virus? And what the studies demonstrate is vaccines provide us longer and stronger protection from this virus. And so that's why, even if you've had COVID-19 and geez, I think I might have had it and I really don't need the vaccine, that's dead wrong. Get the vaccine. It will be more protective for you for now and in the future. And yes, we will need boosters eventually.
So tomorrow I have a virtual meeting with the ambassador from Canada to the United States. And one of the issues we're going to be talking about, as we speak now, the borders between our countries are somewhat closed because of COVID-19. You can, if you have a reason to travel, you can, but it's not an open border like it normally is. And we know that there's restrictions on international travel in recognition that this is a global pandemic. We know that travel restrictions are not going to stop the virus from spreading from one country to another. So this is a global pandemic. The United States, which got off to a very slow start, now seems to be in a pretty preferred position as it relates to the administration of vaccines. Other countries are not anywhere near as advanced. For For example, India, as we know, has been in the headlines of having very, very serious questions about containing the current round of COVID-19. The United States is making arrangements to ship the AstraZeneca, which is yet to be approved, to the foreign market. I just want to get your medical view as to how important is it. I could make the argument on the humanitarian side that we must be engaged, and Congress is actually taking steps for the United States to take global leadership on providing vaccines globally, as well as being engaged globally on fighting the pandemic. So from the humanitarian point of view, to me, there's no question we need to be engaged. But I want to talk about from protecting Americans from this virus. How important is it for us to be engaged so that the global community also has the protection through vaccine distribution? Dr. Gayles?
Well, selfishly, as a traveler, I'm excited about the opportunity for the world to open up again and to travel. But from a professional standpoint, I think, again, to your first comment about humanitarianism, the United States has historically played an important role in public health response and been an important leader in the public health space. And for those of us in the public health field, we think this is definitely a necessary step to reinforcing that role and reinforcing that place within those conversations. It's because if we ever see a worldwide pandemic again, it's going to be incumbent upon us to be a part of those conversations at an early stage to discuss the onset of the pandemic. And as you highlighted early on with some of the failures in the early part of the response, to be able to be proactive in developing a response and making sure we have the necessary infrastructure. I think it's important to get vaccine out to other parts of the world to drive down as community transmission as much as possible as borders do open up from an economic perspective, as well as a tourism or business and pleasure. As more folks travel, it will be in our best interest, because as we drive down the numbers in other parts of the world, it prevents the opportunity for our residents who may go to those places from bringing that back into the United States.
I'll share with you a story on this, which is pretty interesting. We're engaged now in Congress on a debate on our relationship with China. China presents challenges on many, many different fronts, and I'm not going to get into all the human rights problems, all the China Sea problems, all the economic thievery that they do. But they're also using vaccine globally as a strategy for their economic purposes. It's not for humanitarian, but they are producing and distributing vaccines as a way to try to curry favor with countries and wean them off of the support for their Western economies. One interesting story I was going to tell you about this, I had a conversation with a diplomat this week who had gotten vaccinated as a result of the Chinese distribution system, but he didn't think he was safe by that, so he got a second round of vaccines here in the United States just to make sure he was fully protected. He didn't trust the Chinese production system. My point is this: it's in our national security interest, as well as our national healthcare interest, to be engaged to make sure that the global community is protected against COVID-19. We don't want to see this pandemic start again. We took precautions to try to prevent it from coming to America, and we were told from the beginning that that's virtually impossible. And now that we have the variants, which are much easier to spread, it's going to be virtually impossible to wipe out the global pandemic unless there is global distribution of effective vaccines. So I think we all have to be engaged in all of those issues. This has been a fascinating discussion, and the challenge is we're going to see a continuing change over the next several months here in the United States and around the world. One thing is clear to me, and there was a session on this week on preparing for the future. We've got to learn from how we handle COVID-19 We have to have a permanent presence to deal with future pandemics. We have to have a supply chain security so that we can provide the necessary supplies to create the vaccines, the therapeutics, the protective equipment, the medical equipment, the testing that is necessary. All that's going to be important, that we have adequate supplies and adequate strategies and an adequate national strategy moving forward. We didn't talk at all, and we've run out of time in regards to the funds that Congress has made available. But Congress has made available tens of billions of dollars for vaccine development and distribution and testing and therapeutics. And this has been bipartisan. It's the right thing to do. But when we get beyond COVID-19, let's make sure that we prepare adequately for our future public health needs. And in doing that, I hope we'll take advantage of the two experts that we had today. I want to thank both for joining us on our Facebook Live, Dr. Travis Gayles from Montgomery County, the Health Officer and Chief Public Health Services, and Dr. David Marcozzi, the Incident Commander for the University of Maryland Medical System. Thank you both for what you do to keep our community safe, and thank you for joining us today on Facebook Live.